Hi, this is Nadine Celiac, the Gluten Free RN. Welcome back. Today, during episode 39, we are going to talk about dental health and celiac disease. Stay tuned. Hello, everybody, and welcome back to the Gluten Free RN. I'd like to take this opportunity to thank all of you worldwide that are listening to the Gluten Free RN podcast. I hope you are getting valuable information, and sometimes information that you may not have available to you anywhere else. We're talking about all of the important issues associated with gluten intolerance, non-celiac gluten sensitivity, and celiac disease. I encourage everyone that is listening to the Gluten Free RN podcast to leave a rating and a review on iTunes, Stitcher, Google Player, or wherever you listen to the Gluten Free RN podcast. I'd like to thank my friend Sue, who's a retired dental hygienist, for talking to me about dental issues related to gluten intolerance, non-celiac gluten sensitivity, and celiac disease. She really is a wealth of knowledge and has brought to my attention many of the issues that are actually present in the teeth and in the mouth related to gluten intolerance and celiac disease. So we all know that the GI tract starts at the mouth and ends at the rectum. And that's actually a whole tube that goes through our body, but it is actually on the outside of the environment. So the goal of the GI tract is to allow us to consume food and liquid, hopefully not too many other things, and only extract the things from that food and liquid that our body needs for nutritional health. And the rest of it is expelled through urine and stool or feces. So we want to make sure that our GI tract is very healthy. Interestingly enough, we know that the damage from gluten starts at the mouth and ends at the rectum, and then can be a multi-system issue depending on how much intestinal damage there is, both based on malabsorption of nutrients, inflammation, autoimmune issues, and the fact that we have a leaky gut or increased permeability of our intestinal wall, allowing many different things to get into our bloodstream from our GI tract. And that's not how things are supposed to be. So it's very important that we recognize that the damage from gluten can happen in the mouth or show up in the mouth. So dentists, dental hygienists, internists, nurses, we all have to be aware of how this damage can show up and be present in our patients or ourselves, and even our family members. So if you're on the lookout for any of these signs or symptoms, you're going to pick up people that were previously undiagnosed. So I highly encourage people that are in the dental profession or in the medical profession, pay attention to this information. And many of the people out there that are listening, you may find that you recognize these symptoms in either yourself or your family or your friends. Keep an eye out. These signs and symptoms are very present, and I see them every day. Sometimes in people that are just walking by my office, sometimes that are in the grocery store, in airports, wherever I happen to be. It's not hard to find people that actually probably would get better on a gluten-free, dairy-free, and or whole food diet if they only knew that gluten is what is causing some of their symptoms. We all know that sugar and carbohydrates can cause dental caries or cavities in the teeth. But did you know that gluten can also cause things like dental enamel defects, aphthous, ulcers, which are also known as canker sores? My mother always told us that we had canker sores as children because we used swear words, which is not based in any science, but we tended to believe her because she was our mother. The reality is I still use swear words on occasion, and I don't have canker sores anymore unless I get hit with a gluten stick. And if I do get hit with gluten, which means I consume it unknowingly or unwittingly, one of the first signs or symptoms that will happen to me is I'll get blisters in my mouth within 10 minutes of consuming that gluten. So those blisters for me are a warning sign that I've been hit with gluten and to expect some other symptoms to follow. It's also a good idea for me at that time to take some activated charcoal and drink lots of water to flush that gluten, however it got into my system, out. The quicker the better. There are very few things that are going to alleviate or help with those signs or symptoms. But if I can alleviate any of the signs or symptoms, trust me, I'm going to do it. So activated charcoal, flushing with lots of water are some quick, easy ways to potentially diminish some of the signs or symptoms that will follow. Do you ever see people with chylosis, which is spelled Cheilosis? Chylosis is related to B deficiencies or folate deficiencies and can lead to megablastic anemia or be associated with megablastic anemia. They're the cracks or open sores in the corner of the mouth or the lips where the upper lip and the lower lip join. If you see people with those cracks in their mouth, that typically points to B deficiencies. It can be a B complex deficiency, B2, B6, B12, and we really want to correct that. Of course, we want to also ask, why do these people have deficiencies? Dry, cracked lips can also be an indicator, and I highly encourage people, if they have dry, cracked lips and they're trying to put on things like chapstick or lipsticks or things to make those dry lips better, that they actually look at the product that they're putting on their lips and making sure that the product itself does not contain gluten or any derivative of wheat, barley, rye, and sometimes oats. Some of these new products are coming out with really interesting ingredients, and some of them actually contain wheat germ oil or hydrolyzed wheat protein. And we want to make sure that we're not actually contaminating ourselves with a product that has a grain in it. I distinctly remember putting repeatedly a product on my lips, and the more I put that product on my lips, the drier my lips got. And the drier my lips got, the more I put that lip balm on my lips. Well, come to find out, my lips looked pretty funny by the end of this whole ordeal, but that product actually contained wheat germ oil. And this was before I knew I had celiac disease. But I was definitely reacting to the wheat germ oil in that product, but I didn't know at the time that I was celiac. My body was trying to tell me in many different ways, and you really just have to pay attention. At that point, I was not paying attention and didn't get diagnosed with celiac disease for several years. I didn't even know what celiac disease was, honestly. We look for dental enamel defects in adult teeth. We also look for jaw pain, or TMJ, which is temporomandibular joint disorders. Pain in the jaw where your jaw meets, right under your ears. Sometimes people have a clicking in their jaw when they chew, and it can be very painful in those hinges. An inflammation process. So you want to make sure that anybody that has pain in their jaw or TMJ is assessed for celiac disease. That jaw pain can be very distracting and can cause people to have lockjaw, and this is in the absence of tetanus because of the inflammation. So it's difficult to open the mouth fully, and it is a decent reason to actually test for celiac disease. There are many different signs or symptoms to look for in the oral cavity. So dentists should be looking for things like mouth pain or burning, oral lesions, which would potentially be those aphthous ulcers, also known as canker sores, tongue pain or tingling, redness of the tongue, swelling of the tongue sores. Changes in taste and smell can indicate a neurological disorder. It can also indicate malabsorption. So if you have a patient that has a decreased ability to smell or decreased taste, which those tend to go together, and interestingly enough, a lot of the people that have celiac disease have diminished sensory input. So they have a decreased sense of smell, decreased sense of taste, decreased hearing. They may have difficulty seeing or night blindness. They may need glasses at a young age, and decreased sense of touch or pain. So it's always been said that redheads have a high pain tolerance? Well, it might be a neurological disorder that we actually are at high risk for celiac disease or gluten issues because we have red hair, and those people with red hair and hazel eyes absolutely have to be tested for celiac disease. And that doesn't rule out with people with red hair and blue eyes or brown eyes. It's just that study needs to be done to see if people with red hair and hazel eyes are actually at increased risks for celiac disease itself. Dry mouth can be an indicator, sore throat or dysphagia, which is difficulty swallowing, increased thirst. There's many different signs and symptoms, including bleeding gums, which can be a vitamin K deficiency. It's a fat-soluble vitamin, but K is for clotting. And what we want to do is make sure that people are absorbing their fat-soluble vitamins, which are A, D, E, and K. And so typically we test for the vitamin D3. And if a patient is deficient in vitamin D, then we have to assume that they're also deficient in A, E, and K, especially if the level is below 40. I know a lot of doctors think that the range is 32 typically to 32 to 60. But if a patient has a vitamin D level in the single digits or even below 40, I consider that to be critically low. And also a good indicator that they're deficient in every other fat-soluble vitamin. You have to keep in mind that when we used to look for celiac disease in children in the 1920s, 30s, 40s, and 50s, the number one test that would be performed would be a fecal fat score. And these children typically had steatorrhea or fatty stools that would float and they would be pale in color. So if these children were determined to have fat malabsorption, then we knew that they were not absorbing any fat-soluble vitamins, A, D, E, or K. And if they weren't absorbing those, they were having a hard time absorbing any other vitamin, mineral, protein, and this leads to malabsorption. So number one, it's very important that we are consuming a super good high-fat diet, that we recognize that we have deficiencies, and then we work really hard to correct them. Because a lot of these symptoms that we're talking about in the oral cavity or in the mouth and the teeth are actually point back to malabsorption and malnutrition. It's very important to recognize that developmentally, even in utero, it's very important that the mother have proper nutrition. And if she is celiac, she's going to have a child that is going to have a harder time overall and may show up very early on with these dental enamel defects, smaller jaw formation, smaller airway passages right off the bat. And this is all pointing to fetal development. So it's very important that we recognize and test women before they get pregnant, and men too, because men give half the genes for developing fetuses. So we need to make sure and test for the genetic components for celiac disease on everybody. Again, this is my argument for a mass screening, because every generation gets worse, and we need to prevent this damage from occurring because it will take several generations to undo epigenetically some of the damage that's been done. If you have an opportunity to screen a woman and a man before they get pregnant, then you are preventing potential damage to a fetus that hasn't even been conceived yet. I look at my future grandchildren who aren't even conceived yet, and I look at my children and their diets, and I really want my future grandchildren, if I have them, to be healthy and happy and have very good dentition, which is their teeth. I want their bones to develop appropriately, and I want them to have the best brains possible. In order to do that, the mother has to be able to absorb nutrients. And genetically, it's very good to determine whether the mom and the dad, or one or both, actually carry the genes for celiac disease, which are HLA-DQ2 and or DQ8. I'm going to refer to an article that I've included in the podcast notes, and you will see that there are a lot of resources for dentists and for people to take to their dentist so that they can review this with their dentist to make sure that the dentist is educated about celiac disease. There's a great article called An Orthodontic Retainer Preventing Remission in Celiac Disease. And basically, there was a case of a 9-year-old child who presented with nonspecific abdominal discomfort with abnormal serology for celiac disease. She underwent duodenal biopsies that revealed Marsh 3B histopathology. Despite strict dietary elimination of gluten, she continued to be symptomatic and demonstrate positive serum markers for active disease. It was then discovered that the child was exposed to gluten from her orthodontic retainer that contained a plasticized methylcrylate polymer. Gluten is a common additive in plastics. She discontinued its use and demonstrated symptom resolution and complete normalization of her serology. All possible sources of gluten, including non-dietary, must be considered when managing a child with celiac disease, or anybody for that matter, of course. This article also says exposure to non-dietary sources of gluten, which are used in the manufacture of products such as plastics, dental equipment, and cosmetics, can also trigger or exacerbate disease. It's very important and very difficult sometimes to explain to people that it's not just the food that we're eating, it's anything we're exposed to. So here we have a case where this child actually had a plastic retainer in her mouth that contained gluten. Of course she couldn't get better. So we have to be sleuths, we have to be detectives, and we have to have a high index of suspicion for people that aren't getting better, that they're still getting gluten. There's also a great study out of Canada, and this is from the Journal of Canadian Dental Association in 2011, Oral Manifestations of Celiac Disease, a Clinical Guide for Dentists. Highly recommend that you print this off and take it into your dentist, or if you're a dentist, please read it. If you just read the abstract, which I'm going to read for you, basically it says celiac disease, gluten sensitivity, enteropathy is a common disorder affecting both children and adults. As many people with celiac disease do not present with the classic malabsorptive syndrome, delays in diagnosis are common. Dental enamel defects and recurrent aphthous ulcers, which are the canker sores, which may occur in patients with celiac disease, may be the only manifestation of this disorder. When dentists encounter these features, they should inquire about other clinical symptoms, associated disorders, and family history of celiac disease. In suspected cases, the patient or family physician should be advised to obtain serological screening for celiac disease and, if positive, confirmation of the diagnosis by intestinal biopsy. Dentists can play an important role in identifying people who may have unrecognized celiac disease. Appropriate referral and a timely diagnosis can help prevent serious complications of this disorder. It goes on to say the villus atrophy that ensues can lead to malabsorption of a variety of macro and micronutrients, including iron, calcium, folate, and fat-soluble vitamins. Celiac disease was thought to be a rare malabsorptive disorder of infancy and childhood. However, it is now considered to be a common chronic multi-system disorder that can present at any age when gluten is present in the diet. Even in Canada, it says the mean duration of symptoms before diagnosis in adults is 11.7 years. That's unacceptable. We all worldwide need to be much better at recognizing the signs and symptoms of celiac disease, which at this point can be just about anything, any sign or symptom. And even 50% of the population that would say they have no symptoms would have villus atrophy. Again, this is my argument for a mass screening and why everybody absolutely needs to be tested, especially those with any autoimmune disorder, thyroiditis, Down syndrome, anemia, osteoporosis, and many, many, many other associated signs or symptoms. And since we're talking about oral and dental manifestations of celiac disease, I'm going to read their list, which would be dental enamel defects, delayed eruption of teeth, recurrent aphthous ulcers, chylosis, oral lichen planus, and glossitis. Glossitis is an inflammation of the tongue. Those of you that know about Oriental medicine, one of the things that the acupuncturist or the Oriental herbalist will look at is the tongue, because the tongue is a very good indicator of overall health and can be a very good key to what deficiencies are present. If people do have dental enamel defects, it can show up as pitting, grooving, and sometimes complete loss of enamel, according to the Canadian article. I know that my teeth, when you look at it in a certain light, they look like they're all fractured or broken longitudinally. So up and down, they look like they have fractures in them. And I thought that was just normal for me. But come to find out, I have dental enamel defects, and that would have been another great indicator that I had celiac disease for my dentist going way back. So some clinical tips in case you can't open up the podcast notes for these references. The clinical tips given are, number 1, consider celiac disease as a possible diagnosis in any patient with dental enamel defects, recurrent oral aphthous ulcers, or both. Those are the canker sores. 2, question about other clinical symptoms of celiac disease, including abdominal pain, diarrhea, and or constipation. I'll throw that in there. Weight loss, poor growth, anemia, and extreme fatigue. Remember that absence of these symptoms does not rule out celiac disease. 3, inquire about the presence of other autoimmune diseases, especially type 1 diabetes and thyroiditis. The presence of these will further increase the probability of celiac disease. At this point, I want you to remember that I did a podcast way back when, and I mentioned that everybody with type 1 diabetes is a gene carrier for the HLA-DQ2 and or DQ8 gene. Some studies say an actual 100% overlap between type 1 diabetes and the possibility of celiac disease. Consider adding celiac disease to the list of disorders that you inquire about during family history screening. Having a first or second degree relative with celiac disease increases the likelihood of a positive diagnosis. 5. If celiac disease is suspected, the dentist or dental hygienist may wish to coordinate laboratory testing with the patient's primary care physician or specialist. The currently recommended screening test for celiac disease is serum IgA TTG antibody test, which is readily available. The TTG is an IgA-based test, and IgA deficiency is common in celiac disease. Therefore, total IgA level should also be measured. Again, more people that have celiac disease are IgA deficient due to the intestinal damage, which we all know at this point. 70 to 90% of our immune system is in our intestines. Number 6 on this list is also do not recommend a gluten-free diet to a patient suspected of having celiac disease without confirmation of the diagnosis. I would add at this point that if you highly suspect that a patient has celiac disease, get a baseline for the antibody test. Do whatever testing needs to be done, and that should include a genetic test for the HLA-DQ2 and or DQ8 gene. And even if the patient's antibody test is negative, at that point, once you have a baseline, you can always suggest that a patient do a clinical trial of trying a gluten-free, dairy-free at the very least, or leaping to a whole food diet, also known as a paleo diet, to see if their symptoms go away. Because if they have these symptoms, they have malabsorption. And it's a really good idea to address those issues early so that these patients do not have to wait until they have Marsh 4 damage and that average of 11.9 years to finally get a diagnosis of celiac disease. So number 1, we want to have a high index of suspicion for just about everybody for celiac disease at this point. We also want to test people early. Make sure they know they have an option of adopting a gluten-free diet, whether their tests are positive or not, especially if they have type 1 diabetes or any other associated autoimmune disorder, such as MS, ALS, lupus, Sjogren's, the list goes on. If they have canker sores or difficulty swallowing, again, that can be a neurological disorder. If they're clearing their throat all the time, if they have sinus infections, if they have any sensory deficits, such as decreased ability to smell things or their taste buds aren't working appropriately, suggest that they go on a gluten-free, dairy-free diet. Those symptoms can be neurological, and we really want to make sure that people have the ability to experience life fully with a high quality of life. And again, the sooner we can do that, the better. Some other deficiencies that should be tested for are calcium, magnesium RBC, and that's magnesium in the red blood cells, not in the serum. So when your primary care provider is ordering that test, make sure that they know there's a difference between magnesium in the serum level of magnesium, but you really want to know how much magnesium is in the red blood cells. So it's the magnesium RBC test. You'd also like a vitamin D level and a zinc level. Folic acid would also be a very important test at this point. And another thing dentists should be looking for is thrush or a yeast overgrowth. People that are immunocompromised tend to have thrush or a yeast overgrowth. That points to a damaged immune system. So people on chemotherapy or with any known deficiency in their immune system can have thrush or yeast, especially if they've been on multiple courses of antibiotics. This is also a great reason to test for celiac disease and also ask, why do they need to be on multiple antibiotics? Why do they have cancer that they need chemotherapy? Why do they have MS? So we always want to look at the underlying cause. We always want to find the lowest common denominator and treat that cause of all of these other things that are showing up. Also, when we look in the mouth, we see the uvula, which is that nice little body part that hangs down in the back of our throat. Check it for redness, swelling, white pits or patches. People will complain of pharyngitis or throat pain or a sore throat, difficulty swallowing. Again, these can all be signs of gluten intolerance, non-celiac gluten sensitivity, celiac disease. And interestingly enough, people with Down-Turner-Williams syndrome tend to have poor dentition, which means that their teeth tend to be poorly formed. They tend to fall out. They tend not to erupt on time. And again, these people are at high risk for celiac disease. So if you have patients that have Down's, Turner's, or Williams syndrome, you want to test them for celiac disease, and not just once. One test will never rule anyone out for celiac disease proper. They also tend to have a lot of GI issues. Gastrointestinal upset, such as diarrhea, constipation, they're picky eaters. So anybody with any of these symptoms, celiac disease needs to be on your radar. Again, all of these things are preventable. All of these things are hopefully treatable. At some point, there's damage done, and we can't undo that damage. So we want to make sure that we're looking for people that are gluten intolerant or have celiac disease to prevent any of these things from happening, even in utero. And keeping in mind that celiac disease is primarily neurological. So we want to look at all of the senses. We want to look at the senses of smell, taste, hearing, vision, and touch. It's very important that people know that everything is connected, and celiac disease will present with symptoms, and those symptoms tend to accumulate over years. So the quicker and the faster that people can get diagnosed with celiac disease, the sooner they can get on a 100% gluten-free diet and prevent other things from happening and prevent the inflammation that occurs and the autoimmune issues that can accumulate and that people can collect over years. We don't want those things to happen. As healthcare providers, we'd like our patients to be as healthy as possible, of course. Food is medicine, and we want to treat our food as such. So we want to make sure that we're getting the best food possible, food that's organic, hopefully local, as fresh as possible, and full of nutrients or nutrient dense. Limit your sugar intake, and the more you can work towards a low carbohydrate, high fat diet, the healthier you're going to be overall. So low carbs, low sugar, and a super good high fat diet. It's good for your neurological system, it's good for your brain, and it's good for your body overall. Thank you for joining me for episode 39 on dental and oral issues associated with celiac disease. As Dr. Michelle Piecyk, a pediatric gastroenterologist, says, she can diagnose celiac disease with a smile. And the diagnosis of celiac disease can sometimes be made with a smile. Henceforth, dentist, dental hygienist, physicians, anybody that looks in your mouth should be looking for damage from gluten. And this includes ENTs or ear, nose, and throat doctors. Celiac disease is not hard to find, you just have to be aware of the signs and symptoms associated with it, which can be many. Once again, I'm Nadine Griskowiak, the Gluten Free RN. I hope you found this information to be extremely helpful. This has been episode 39 of the Gluten Free RN podcast. Keep smiling and keep looking for celiac disease. You'll find it. Until next time, bye.